Hi friends, today we'll discuss about ICD-10 coding guidelines for diabetes. Many coders have confusion in coding type 2 diabetes or secondary diabetes or type 1 diabetes. So today we'll discuss some ICD-10 coding guidelines for coding these different types of diabetes in ICD-10 coding. So first we'll check the type of diabetes. So mainly there are three major types of diabetes: mellitus, is type 1 or type 2, and secondary diabetes, which is caused due to underlying condition or induced by a drug or chemical. So type 1 diabetes, also called as insulin dependent diabetes mellitus or IDDM, and also it is known as Julian type. It is characterized by the body failure to produce insulin. So in type 1 diabetes there is no production of insulin, and hence it is categorized as type 1 diabetes. While in type 2 diabetes, the body is able to produce insulin, but it is not sufficient, or it is not in sufficient quantity, or the body is not able to utilize the insulin. So that is categorized in type 2 diabetes. So the main difference in type 1 diabetes is and type 2 diabetes is there is no production of insulin in type 1 diabetes, while in type 2 diabetes either insufficient or the insulin is not properly utilized by the body. So coming to the ICD-10 coding categories, E08, E09, E10, E11 and E13 are the major categories for coding and diabetes. For type 1 it is E10, and for type 2 it is E11. And other three are E08, E09, E13 are used for coding secondary diabetes. Do not use E10 and E11 for secondary diabetes because it is against ICD-10 coding guidelines. Coding guidelines for diabetes. These are simple ICD-10 coding guidelines for diabetes. If the medical record documentation is not clear with regard to a type of diabetes, by default the category code will be 11.9, actual specific code for type 2 diabetes, unspecified. If there is a long-term use of oral hypoglycemic drug, we have to use code Z79.84. That is used for long-term use of oral hypoglycemic drug for routine use of oral anti-diabetic medication. And for long-term use of insulin, there is another code Z79.4. It is mainly used for like type 1 diabetes patient because they require insulin regularly, because the body is not able to produce insulin, hence they require long-term use of insulin. So periodically they need insulin for controlling the diabetes. Only the code for insulin use is assigned when the patient is treated with both oral medication and insulin. So here if both oral medication and insulin is given, you have to give only the insulin code, long-term insulin code, that is Z79.4. Now coming to the secondary diabetes, the category is E08 first, that is secondary diabetes that is caused due to underlying condition is coded to category E08. So here you can see the coding instruction. First you have to code the underlying condition like congenital rubella, Cushing syndrome, cystic fibrosis, malignant neoplasm, malnutrition, pancreatitis and other diseases of the pancreas. So these should be coded first, followed by the E08 code, and any control method is there like use of insulin or hypoglycemic or anti-diabetic drug, you have to assign the Z code as per the documentation. Code from the categories E10 and E11 should not be assigned for secondary diabetes, which we have already discussed previously. Since this is secondary diabetes, we cannot code the type 1 and type 2 diabetes in this category. Coding guidelines for secondary diabetes. Again, the another code category for secondary diabetes is E09, that is drug or chemical induced diabetes. So here also you have to first code the poisoning due to drug or toxin, if applicable, that is from category T35 to T65 with 5th or 6th character 1 to 4 or 6. So here what happens, the secondary diabetes that is induced by the drug or chemical is coded to category E09. So for example, if a steroid-induced diabetes mellitus due to prolonged use of prednisone for an unrelated condition is coded as E09.9. Drug or chemical induced diabetes without complication followed by code T380X5 series for adverse effect of glucocorticoid or synthetic drug. So you have to code the adverse effect or first the poisoning code, and then you have to use the additional code for the adverse effect, that is from T36 to T50 series, and then you have to give the additional code to identify the control, that is any insulin or anti-diabetic drug or hypoglycemic drug has been given. So this will be the sequence. Secondary diabetes, that is due to pancreectomy, is coded to E89.1. Post procedural hypoinsulinemia, assign a code from category E13 and either code Z90.410 for acquired total absence of pancreas or code Z90.411 for acquired partial absence of pancreas as additional diagnosis. So if a secondary diabetes happen due to pancreatectomy and removal of pancreas, partial or total, you have to use the category E13 series for secondary diabetes. So here for example, a pancreatectomy diabetic mellitus due to surgical removal of part of the pancreas is coded as E89.1 first, then followed by the E13 series for secondary diabetes, and the final code will be Z90.411 for the removal of pancreas, the absence of pancreas. So and any additional code as usual you have to use the code Z79.4 or Z7984 for insulin or oral anti-diabetic or hypoglycemic drugs use. So type here the diabetes type 1.5, which is most confusing for coders, is actually assigned to category E13 series. Then again it is a secondary diabetes. So these are the coding guidelines for coding diabetes for type 1, type 2 and secondary diabetes. We'll discuss the other guidelines like for coding diabetes in pregnancy or overuse or underdosing of in another video. Till now we'll discuss only these things, because again that will make a lot of confusion if we discuss everything in one video. So hope you have cleared your confusion regarding coding type 1, type 2 and secondary diabetes. If you have any doubt or confusion, you can give your comment in the you can give your feedback in the comment section, and if you like the video, do share it, and please do subscribe to my channel to get regular updates regarding medical coding. Thank you.